Technical glitch again today. My apologies. I thought I had everything worked out. Apparently, I did not because I forgot to set it up so that it would switch to the next scene automatically, which would be my camera. And I didn't do that, so I just fixed it now. Not that you care. It's not that important to you, really. It's only important to me. I just need my tech to work right so I can get things done correctly. So how you doing, folks? It is Thursday, December 4th. And it's very chilly in the nation's capital today. I don't know if you've had a chance to check the temperature. I don't know where you are, but it's cold here today. Wasn't so bad this morning, but currently it's about minus 21 with the wind chill. So that's chilly. Now, pardon me, didn't mean to bark into your ear like that. My apologies. This is medical fraud. Medical fraud, part 4. This story that has been haunting me for the last few days, and it all started when I read about this woman, Susie Silvestri, and the hell she went through at a medical recovery facility, I guess you could call it, if you want to call it that. It's not really that. Come on, it's a place where they separate you from your money by giving you hope in a hopeless situation. We'll pick up where we left off with the last couple of paragraphs and carry on from there. From a woman by the name, her surname is Curbs, said she asked senior managers why so many people seem to arrive with this belief that they would be healed. We were told that they weren't told that and that they were just grasping at straws because that's all they have left, Curbs told CBC. She said management also suggested the clients may have believed that they would be healed because they have cognitive issues. Now that sentence and statement right there is a dead giveaway that the whole thing is a scam. Let's go back to that. We were told that they weren't told. They weren't told that they could be healed. They're just grasping at straws because that's all they have left. Clients may have believed that they would be healed because they have cognitive issues. This whole thing is a scam. It's a scumbag who is scamming people out of their life savings in many cases at the end of their life, giving them hope when hope is not to be had. ALS is terminal. Saying we can cure people 100%. And then telling staff that no, we never told them that. These people are scum. This Good Now guy's scum. I feel for all the people that participated and didn't get what they were promised, Curbs said. It's terrible. If I could leave, I would. Susie's joy with her new environment did not last long. 3 days after arriving, she told Charles, her brother, I'm having a hard time right now. Can't cough up and out the phlegm. If I could leave, I would. So difficult. That same day, she was taken to hospital and diagnosed with COVID pneumonia, according to medical records provided by her family. After a week in the Moose Jaw Hospital, she went back to the Goodnow Center where she was put in isolation so she wouldn't spread her infection. It was becoming increasingly difficult to take Goodnow's Plasma Logan supplements. Today, I just wanted to cry, started full protocol, torture taking all the supplements, Susie told Charles in early October. As a result, she wasn't able to take all of her recommended supplements all of the time. By early November, she told Charles, I'm doing good. Saw Dr. Jeet yesterday. He is happy with my progress. Curbs said she and the other staff worked regularly with Susie to improve mobility in her hands, feet, and arms and found some modest success. However, during this time, staff took Susie to the hospital on multiple occasions. According to hospital records, Goodnow workers report that she is having difficulty expectorating phlegm due to the ALS and weakness. Curbs said hospital staff were not supportive of Susie being at the Goodnow Center, and some suggested she should go home. Curbs said Susie would exaggerate how well she was doing in the program out of desperation to continue. The nurses at the hospital would say, so Susie, have you been able to get some more mobility from the program? And she'd wink at you and go, yeah, mobility's getting much, much better. And it's like, we know that's not fully accurate. Goodnow facility unregulated. According to Susie's hospital files, attending physician Dr. Ryan Sanchez raised red flags about the Goodenow Center, warning Susie that any claims of efficacy may not be backed by scientific evidence. I do have very serious concerns about her safety at that facility and whether she will be able to receive the specialized care that she requires with her advanced neurological disease, Sanchez wrote. The Goodenow Center is a private business, unregulated by the province, and has no ties to the Saskatchewan healthcare system, according to the Ministry of Health. In an email, government officials said the Goodenow Center is not considered a personal care home, so it does not require a license to operate. There is no indication it provides assistance to or supervision of a resident in performing activities of daily living, the ministry told CBC. Instead, the province said the Goodenow Center is more like an assisted living facility, offering food, lodging, and light housekeeping. However, on its website, the Goodenow Center says, we take care of everything for people living in the facility, including blood testing, supplements, and rehabilitation support. Dan Florizone, a former Saskatchewan Deputy Minister of Health, said it's surprising that this facility is unregulated, given the level of care it offers and the condition of the clients it serves. We've got care delivered to those with high needs to a vulnerable population in a facility that has not been inspected, said Florizone, who now teaches at the University of Saskatchewan's Johnson Shoyama Graduate School of Public Policy. It's most likely that Goodenow clients haven't just given $100,000 to be in some assisted living setting. Curbs, the former Goodenow employee, said most clients had family members with them to provide care, and most were not in as dire a condition as Susie. But she said she and the other staff did regularly provide a significant level of care for Susie and a handful of other high-needs clients. We would lift them a lot to take them to the bathroom, help them with their clothes, she said. Some people couldn't lift their arms to eat, so we would have to feed them, she said. In Susie's case, Curbs would change her briefs throughout the day. Curbs said she always found it strange that the facility was not well suited for people with severe mobility issues like many of the Goodenow clients. For example, there was no elevator or lift to move patients from the first to second floor. Goodenow said his program uses the stairs as a source of inspiration. He told the CBC that clients will come in not being able to walk or basically not being able to get out of a wheelchair, and the goal is, within 3 months, to get them walking upstairs. Susie's brother Charles said it's infuriating that Goodenow accepted Susie into the facility, knowing her fragile, deteriorating condition, and that the provincial government allows this. I mean, these people are declining, said Charles. They've got to expect that there's going to be medical problems, and you don't have any facility to take care of them, you know? It's kind of crazy. Goodenow employee advocates for Susie. On December 3rd, a Goodenow employee arrived at work and was stunned by what she found. In a text message to a friend, she said that Susie had not been eating for a few days due to her not being able to swallow anything anymore. We know about this Goodenow worker's story because she shared her text messages from this time with a friend who shared them with CBC. This worker declined an interview. She also asked that the CBC not name her because of the trauma this situation caused her and concern about possible legal repercussions. Let me read that again. I screwed it up. Sometimes that happens. This worker declined an interview. She also asked that CBC not name her because of the trauma this situation caused and her concern about possible legal repercussions. The worker immediately took Susie to hospital and raised concerns with management about the care the Goodenow Center was providing. Ultimately, Susie came to us with hopes of recovery and improvement. The worker texted Jana Hornsmall, the CEO of the Goodenow Center. I urge us to reassess how we can best support her during this challenging period. Horsnall, who is Goodenow's sister, replied that Susie knows that we are very good and give our best. That's better than any place anywhere. She added that Susie is in better shape than when she came. Horsnall told the care worker that she was taken off guard by Susie's COVID pneumonia, which was diagnosed a few days after she arrived in Moose Jaw. We would not have taken her if she needed medical care, Horsnall told the worker. On Susie's intake form submitted with her application, she said she needed a wheelchair and a mechanical lift to get out of bed. She also indicated she required help with bathing, dressing, and going to the bathroom. Self-directed research. While Susie came to the Goodnow Center expecting healing, she had signed an agreement with the facility to take part in a research program of sorts. A 20-page customer research agreement. She mentioned it to Dr. Ryan Sanchez at the Moose Jaw Hospital. In his notes, he wrote that Susie was under the impression that she was participating in a clinical trial, testing some novel agent for the treatment of ALS. When he asked a Goodnow employee if this supposed clinical trial has any research ethics board, approval, or institutional affiliation, the worker said he wasn't at liberty to disclose that. Sanchez warned Susie she likely is not participating in a legitimate clinical trial. In interviews, Goodnow described his program as self-directed research, telling CBC people come in of their own voluntary will, and they develop programs for themselves. When Susie paid her $84,000 US fee, she also signed the research agreement saying she was interested in collecting personalized clinical, behavioral, physical, and biochemical information and using it as part of a self-directed research program to optimize her health and well-being. I have the document and I will share it with you later. Susie's brother George said he doesn't recall her ever saying she was going to Moose Jaw to conduct research on herself. Instead, he said that she went to Moose Jaw with the belief she's going to receive treatment and be healed. Goodnow's brochure promoting the program seems to fuel that expectation. It promises to provide ALS, Parkinson's, and Alzheimer patients with a treatment plan that will restore their bodies to, in quotation, original manufacturer's specifications. The 20-page brochure focuses in detail on Goodnow's plan to restore, repair, and rehabilitate patients, while mentioning the term self-directed just 2 times. Once on page 18 in a section saying, everyone is capable of becoming an expert in their own restorative health journey. The second mention is in a small print disclaimer on the last page saying the Goodnow Center operates as a self-directed research model and is not a medical facility. George said Goodnow's customer research agreement seemed designed to protect Goodnow rather than help his sister. When I read the contract, it seemed like it was really written to absolve the clinic of pretty much any responsibilities, George said. It's all about, you're basically coming up here and you're on your own. The contract says the Goodnow organization will collect extensive data on customers during their stay at the program, and all of those documents and samples shall be returned to the customer upon request. Susie's sister, who has power of attorney over her estate, has requested this data, but the Goodnow organization has not replied. Susie looks for U.S. hospital. By early December, it was becoming almost impossible for Susie to eat. She began begging hospital staff for a feeding tube. However, her American insurance company wouldn't pay for the surgery at the Canadian hospital, and the Moose Jaw Hospital would only do the surgery on a non-Canadian in an emergency situation. Dr. Ryan Sanchez wrote, I have encouraged her to consider returning back to her home country, as this procedure likely cannot be carried out locally, in a notation on her file. The Moose Jaw Hospital did install a nasal feeding tube, which Susie's insurance covered, but hours later she asked to have it removed as it was making it difficult to breathe. It was at that point that Susie knew she had no other choice. She had to leave Canada and head to the United States. She summoned the strength to hunt for a hospital in the U.S. that would accept her insurance and perform the surgery, and she had to do it virtually alone. Aldana Curbs told CBC it was heartbreaking to see little Susie with her laptop trying to figure this stuff out. Curbs said while staff tried to help where they could, she said management should have made more of an effort, in my opinion, to call around and find her the appropriate services. Susie was able to find a hospital in Sydney Montana, I guess. Sydney, Montana. That would make sense. 4 hours south of Moose Jaw that might accept her insurance and do the surgery. The anonymous care worker stepped up to help, assisting Susie with hiring a patient transport vehicle and arranging the trip to the U.S. I'm strenuously working to support Susie through this challenging period, she told Goodnow CEO Jana Horsnall. The worker borrowed her dad's heart monitor and oximeter so she could keep an eye on Susie's health during the trip. I myself is not even qualified, she wrote to the friend who shared the text with CBC. I only operate through compassion. Throughout this process, I felt that there was a lack of support from the management at the facility, which made things even more difficult for both of us. The worker said Susie was being blamed by the center for not having a plan to get home. However, Horsnell disputed that. I assure you, Susie had a plan of how to get home, Horsnell told the worker. Her condition is not due to our care. We all have gone way above what was planned for her care while with us. I understand that she is desperate, but that doesn't make us the bad guy. We've done everything we can to support Susie, including paying you for assisting her and arranging her medical care, Horsnell texted. Who enforces the law? The Goodnow Center is very public about the fact it has no medical staff and is not a medical facility. Goodnow has a PhD in medical sciences with an emphasis in psychiatry from the University of Alberta. However, he is not a medical doctor and is therefore not a member of the College of Physicians and Surgeons of Saskatchewan. Saskatchewan Health Minister Jeremy Cockrell told CBC that Goodnow is not a licensed medical doctor, so he does not fall under any established health regulatory body. In an email to the province, CBC pointed out that Saskatchewan's Medical Professions Act forbids non-doctors from offering to treat or actually treating medical conditions for a fee. Section 80 says it's against the law for someone who is not a registered medical professional to give advice or treat any disease or ailment by medicine, drugs, or any form of treatment, influence, or appliance. It is also against that law to advertise such services. CBC pointed out to the province that in Goodnow's brochure and on his website, he promises to create treatment plans for his clients suffering from neurological or inflammatory conditions, which will restore their health. The province told CBC that if someone believed the Goodnow organization was violating this law, they should contact the College of Physicians and Surgeons. The college shot back, saying the government is wrong. I disagree that the College of Physicians and Surgeons is the agency designated to prosecute offenses that the government of Saskatchewan has adopted into Saskatchewan legislation, wrote Brian Salt, Associate Registrar and Legal Counsel with the college. There is nothing in the Medical Profession Act 1981 that supports that view. In response, the government acknowledged to CBC that there seemed to be some confusion on this point, promising a review to ensure there is no clarity on who enforces the act. To date, it still won't say which agency, if any, enforces this law. Dan Florizone, the former Deputy Minister of Health, said the government needs to sort this out, as there is a growing number of private businesses offering care on the edges of the mainstream system without much oversight. He said 30% of healthcare in Canada is privately delivered, and that number is going up. The legislation as it currently stands gives very few tools in the toolkit to be able to deal with this new and emerging type of entrepreneur, said Florizone. He said the Goodnow situation is a gift of sorts, as it has highlighted some key gaps in regulation. You don't represent us. Susie and the anonymous Goodnow care worker arrived in Montana on December 8th and were thankful the hospital agreed to help. Susie and I came here on a leap of faith without assurance if we are ever going to get accepted, said the worker. A few days later, Susie had her feeding tube, but her condition continued to deteriorate. Jana Horsnell urged the care worker to make sure Susie was taking her plasmalogen supplements, saying, "The doctors there may not understand them, but they are very good and will help," the care worker told Horsnell. The doctor said no. According to the care worker's text, she stayed with Susie from December 8th to December 16th. She said, "Nurses are making sure I get to eat by giving me meal vouchers every day." Susie was desperate to go home so she could be close to her family, but she was losing hope and began to research assisted suicide. The Goodnow worker told Horsnell about Susie's despair in her research. Horsnell's tone took a dramatic turn. "I am shocked. You do not represent us," Horsnell wrote to the worker. "I know she hired you and you are there on your own with her. There's nothing to do with us." The worker replied, "Susie's not just a friend. She's an aunt to me now. Although Susie was willing to pay me, I declined." In a text message to a friend, the Goodnow worker described her reaction. "She gaslighted me into saying that Susie hired me in person to be with her, and that has nothing to do with her company, which was far from the truth," the worker texted. On December 16th, the care worker left Susie's side. That same day, she quit her job at the Goodnow Center. I realized that these people had been taking advantage of vulnerable clients like Susie, she wrote to her friend. When CBC reached out to Goodnow about this story, his lawyer, David Brundage, replied, "We are hoping not to litigate this matter in the media." I am fading fast. On December 21st, 2024, Susie texted her siblings, "I am fading fast. We love you. Stay as strong as you can," her sister Nancy Riviero wrote. "We're working on getting you home." That was their last written exchange. In her final message, Susie sent a picture of a Christmas tree hospital staff had set up in her room. Susie Silvestri died on December 26 in the Sydney, Montana hospital. Her death certificate says she died of ALS with acute and chronic respiratory failure. Her brother George said he deeply misses her and is disgusted by how she was treated. They're preying on people that are looking for answers where there may not be any at this time, he told CBC, offering people false hope. And that's the gist of it right there. It's false hope. There is no coming back from ALS. His plasmalogen treatment may have a nugget of possibility in the future, down the road at some point in time. But in all honesty, and I'm no neurological expert by far, I'm not a doctor, so don't take this with a grain of salt. But I think if we're going to fix a neurological problem like ALS, it has to be done by altering the human DNA, the genome, via CRISPR. And we could have a whole other conversation about that some other time. If you're not aware of what CRISPR is, it's CRISPR. You can look it up. There are tons of articles and documents. The individual, the woman who created this, the doctor who created, scientist who created this CRISPR software, won a Nobel Prize for it in medicine for advancing human knowledge. There are many things CRISPR will be able to do in the future, but right now it's not. It's not there. It's going to take a long time, and there's tons and tons of data. Perhaps with quantum computing and the assistance of AI and CRISPR, we can find a cure for ALS someday. And that someday may be in the near future, but it's not going to be via supplements that some psychiatrist seems to think will fix you. The guy's scum, and he's preying on people and taking their money at the end of their lives. These are not good people. They aren't. And we need to figure out a way to make them be held responsible for what they've done, because they have harmed people and they did it knowingly. That's a heavy story. If you want to sit back and watch all 4 parts in one shot, by all means, please do so. If you can do me the biggest of favors, though, and share this short 4-part series with as many people as possible, because we need to get the word out about this. People need to know what is happening. People need to know that this is being done to vulnerable individuals at the end of their lives, because it's wrong. And I don't know what else to do other than spread the word, get it out there so we can lobby the provincial government. If you live in Saskatchewan, talk to your MLA, please. We have to do something about this. This cannot continue. They're giving people hope when there's no hope to be had. I mean, this poor woman, Susie, died away from her loved ones because she was convinced, according to the documentation that he gave to her and the 20 pages of information that they shared, that, yeah, she was going to walk out of that door. That was never going to be the case. So please do me a favor, share this with as many people as you can. We need to get the word out. We need to get this fixed. If you're in Saskatchewan, please contact your MLA about this story. Reach out to them and tell them that you're concerned, because this just should not be happening. This has been your Grizzly Growl. I will be back tomorrow at 6 p.m. for the weekly wrap-up, when I will discuss the news and some of the things that have transpired this past week outside of the story I just told you. And as I'm working from home tomorrow, I'm going to pop in for a little bit to spend some time with Mr. Beaver. I'll see you soon. Take care.
Yeah.